Welcome back to Stat Bites, and I'm going to tell you about the time that I nearly died 3 times in a row. Obviously I haven't recorded a video in a while, but I'm going to explain why. There is going to be a lot of medical information in this, and there is going to be pictures. Not all of me, but some of the procedure and some of me. And so if you're sensitive, you might not want to watch this video because I'm going to go into some detail. But yeah, basically I had to have major abdominal surgery that resulted in my duodenum having to be removed. The duodenum is the small part that comes off the stomach, just as it goes into the small intestine. So the stuff your food goes through your esophagus, through the sphincter in the stomach, and through another sphincter into the duodenum, and then into the small intestine. At least that's what it looked like when I was watching the camera. Anyway, what caused this? Why have I had to have so long off? Well, I've been ill for about a year and I didn't even realise, and I nearly died because of a stomach ulcer. A stomach ulcer. You hear about these things all the time, and I had no idea that these things could kill you. So for about a year we didn't know I had a stomach ulcer. It seems to have been caused by naproxen, and I wasn't using my stomach protection properly, and it resulted in an ulcer forming. And what actually happened is that my hemoglobin count dropped, and over time my back pain got worse and worse, which, because of my chronic conditions, with my back pain and autism and that, it kind of masked a lot of what was actually happening and the kind of symptoms that a doctor would usually use to find that you're actually losing blood. And my doctor kept saying to me for month after month, you know, we should get your bloods checked just in case. We should get your bloods checked just in case. Chris, have you had your bloods checked yet? And I don't know whether it's the autism or me just being bloody stupid and never bothered to do it. I didn't know to ask the right questions. Why should I get my bloods checked? So you have a hemoglobin count. That's how many red blood cells you have per, I guess, milliliter in your body or whatever. And I had a hemoglobin count of 52. Your normal hemoglobin count for a 6-foot man, and I was 12.5 stone at the time, and I'm 6 foot. My hemoglobin count should have been 110 to 130, and my hemoglobin count was under half that. And it was basically a surprise I was even still walking. And what happened one day is I woke up in the morning, my partner saw me and she says, Jesus Christ, you look like a ghost. I think we need to call an ambulance. Your lips are pale, your face is just white as a sheet. I'd been sick the night before and I puked up like specks of blood, but I didn't think it was anything. I thought I'd just hurt my throat from throwing up. And went to hospital, found my hemoglobin count, they put in loads of blood. Then the next day they stuck a camera down my throat. It's called an endoscopy. It could go in either end. This one, they went in my throat, down my esophagus, into my stomach, and they can offer you basically fentanyl and metalopram, I think it is, as a cocktail to help you stay calm. But I was like, nah man, I want to see this, because I had an idea of what stomach ulcers were like, okay? I've seen pictures of them. And because it was obviously such a slow bleed, I thought it's not actually going to be that bad. I kind of want to see what's going on. I was not ready for the eye of fucking Sauron that I saw. The camera went through my esophagus into my stomach, as it went through into the duodenum. As it went through the hole in the stomach, it basically opened up, and sorry for the graphic imagery, but as the stomach hole opened up, we all saw the stomach ulcer. It was 4 centimeters by 4 centimeters, and it was concaved, which meant it was deep, and it was basically an inch wide, the diameter of it. I did some research afterwards. The biggest stomach ulcer that's ever been found was by Crohn, of Crohn's disease. He found a stomach ulcer in a woman that was 8 centimeters by 3.4 centimeters, and she actually passed away because it cut through to her pancreas, and she ended up losing her life. So mine being an inch wide is very significant. And anyway, I panicked. They pulled the endoscopy out because I started like retching on the deep throat in the machine. So I started retching on it. So they pulled it out. Like, okay, no, we're going to start this again. We've seen this huge ulcer. We're going to give you the metalopram and the fentanyl. They actually gave me 2 doses of the metalopram, 1 dose of the fentanyl, and stuck the endoscopy down again. I was just fucking away with the fairies at the time. and they stapled it up. So basically they apply these clips. I'll show pictures now. They kind of like fold it over and clip it down to try and help it to heal, and they use like adrenaline shots to help it stop bleeding and things like that. All well and good, brilliant. Stay a couple of days in the hospital, build up, start eating soft things, like ice cream and yogurt and just simple sandwiches and things like that. And a few days later, I'm all right. Okay, job done. Excellent. Go home. Go home. I'm home for 2 nights, and then I vomit up blood, and like just proper dark. Looks like dark red wine. The consistency, everything. All my food was coming up in it, and yeah, that was rough to see. Because my partner, she's amazing. She's been a rock through this whole thing. I'll talk about her later. Got a saucepan, and I vomited up into the saucepan. Called 999 straight away. They were here within 10 minutes. Did all their tests again. So this is the second ambulance call in a week, and yeah, they sort me out, get me into hospital straight away again. Loads of blood going in, vomiting up more blood, loads more blood going in. I do that because they squeeze the bag to get it into you really quickly, and then they get me in for another endoscopy. And what they find is that a vein's burst next to where the ulcer is, and it's been clipped over, but a vein's burst next to it. They repaired the vein. I'm on the ward. I'm there again for a few days, and things are going really well. So like, oh, okay, you can go home. My partner comes in to pick me up, and what happens? I keel over in the ward. I just passed out on my bed. I was like flopped over it, apparently. I have no recollection of it. All I remember is that I was sweating loads. I felt really hot, and I wanted to open the window. So I got up to open the window. I went to stagger towards it. I kind of nearly fell over. I was like, oh no, I'm just going to sit down. And then I sat down against the bed, and I sort of laid against it. I was like, oh, I felt really relaxed, really happy, and that's a bad sign if you're losing blood. If you start feeling really good, it's almost like a euphoric feeling because you don't have the oxygen in your brain. I think, at least that's what my psychology tells me. Not psychologist, my psychology degree. Where was I? Yeah, and then apparently I was as we know now, I was unconscious, but I was still conversing with my partner, and I was like moving around, sitting up, laying down, and then all of a sudden I sat up, upright, and it just flopped over. So my partner just grabbed the emergency button, yelled for the nurse, and was like slapping my face, trying to get me around. And the next thing I know, I'm waking up, I'm spread eagled on the bed, upside down, so I can get like blood into my head. I've got 2 healthcare assistants trying to get a catheter in me. And then I've got an anaesthetist squeezing blood bags and plasma bags to get those into me. I've got a ward sister overseeing everything, getting cannulas in and everything. Honestly, the NHS staff in a crisis are amazing. Anyway, what they find is that the repair on the vein hadn't worked. So what they do is okay, we can get you in for another endoscopy, check what's going on, and then we'll make a decision. So the way that the hospitals are in the UK is that not every hospital can work and do, like, they can't work on the same things. So they needed to assess what the damage is to figure out what to do. And so they put the endoscopy in again. No, this time I couldn't have sedative because it could mess up the anaesthetist's job. So I have no sedative, and I could kind of see just past the endoscopist, and they're like sticking the tube in, and then they get to my stomach, and there's just clots everywhere. There's just blood all in my food, like in my stomach. I had no food at the time, so it's just like stomach acid and blood, and I go through, and there's clots. I can't even see what they're doing, and they're like, okay, yeah, no, we're going to operate. They whip the endoscope out, and then the surgeons are conversing. The nurses are all talking to me like, oh, don't worry, it's okay, you're in good hands. And actually, the way that they were talking actually made me feel a lot better. Because the whole thing was just bewildering. I didn't even know what to make of it. And anyway, they decided to operate on me in this particular hospital. And they said, okay, we're going to remove your duodenum because there's no point trying to repair it. We tried to do it twice, and it's ripped every time. So we're going to just remove your duodenum completely. And now I'm son's duodenum. But the story doesn't end there. I know it's almost monotone and I'm going on a bit, but dude, I still haven't nearly died the third time. This is the crazy bit. So, I get off of the, I come out, and then I'm all well and good out of the surgery. Everything's going fine. I have about 15, 16 staples in me, maybe 20. I've got a scar down here between sort of my sternum and my belly button. It's literally that long. I'll put up some pictures. And the thing is, so then I get to go home again, but then I'm like eating as normal, like not normal food, but I'm eating a bit less. But then I'm getting like really weird, like, so I've got a really chesty cough, and my staples are killing me. So every time I cough, it's like really like wrenches the staples, and it wrenches like because there's two layers that they cut into. So there's the layer of the skin, and then underneath is all the muscle and everything that binds it underneath. And I'm having trouble with this really chesty cough I contracted on the ward, because there was a really sick guy there. And I'm starting, like, I'm getting like a weird lump on my, like, just next to the wound, just after the stomach, and it's like really, like, you compress it, it's almost like a bouncy castle. And so I have to go back, and it turns out that like blood starts seeping through where the stitches and the staples are. Every time I cough, like, blood comes out, and it turns out that my stomach had stopped working, which is a complication that can happen with these kind of surgeries, is because I hadn't eaten for so long and my diet had been so reduced for so long, like nearly 2 weeks. They operated and got rid of duodenum. The stomach has to figure out how to work again, and then sometimes sometimes I can't do that, and so they had to put a drain out all my stomach contents out, and see if, like, the lump went down, or if I had a hernia, like a disinterniation, I think they call it, or a disinherniation, something like that. It's a specific word for this type of hernia. And it turns out I had both. So they pull out all of the stomach acid, comes out. It was really gross. They stick the tube up your nose, down the back, into your throat, down into your stomach, and then drain out all the stomach acid. And then I still had the lumpy bit, and then the blood was still coming through the stitching. And it turns out, when I read, they didn't tell me this because they're discreet, but the exact words is, we gave the patient emergency surgery because they were at risk of evisceration on the ward. Evisceration, that's a hefty word to use. So they got me in the middle of the night, cut me open again, put everything back together. They gave me like a porcine sheath, like a pig. It's basically pig. So I'm a pig in a blanket now, or the reverse. I'm a human in a pig blanket. Yeah. So, like, to strengthen it, because I still had a bit of the cough. And then they gave me 31 staples this time instead of the 16 before. And then I just had to recover on the ward again, and I go home, and then that's where I am now. And I now have an infection, but at least that's not going to kill me because I've got antibiotics. Yeah, so those are the 3 times I nearly died, all from one stomach ulcer. That's all it took, one stomach ulcer. So listen to your doctors, especially if you're neurodivergent like myself. I'm autistic, as I've mentioned. And use your support circles. Don't be afraid to ask for help. The only person I have in my life really is my partner. I've got a few friends, but obviously they're really far away, and my partner's been an absolute rock. I don't even know where to begin with her. Showing up every single day, putting the hours in, making sure I'm okay, keeping her feelings in check enough that I didn't have to worry. I'm worrying now because I'm coming out of it, and we're going to work on that together, and help her overcome what she's been through. Because I think the best way for partners to do it is to take it in turns. That's kind of like what we do. And so she was there for me the whole time. She was the one that urged the ambulance calls. She was the one that followed the ambulance. She sat in the hospital for hours in the emergency room waiting. Sorry, I'm getting emotional. I spent a bit of time in the army. Let's just start there. I was in the territorial army, not the real army, the weekend army. I've been a mechanical engineer. I've been an academic. I've been a sick person. I've been autistic. I've been a member of many of these so-called communities. But never have I seen anybody put themselves on the line like my partner did for me for 3 weeks. I just don't know. I don't think I need to say anything else. You know, it's not the nearly dying that bothers me. It's not the operations. It's not all the pain I went through. It's what my partner had to go through. That's what hurts. That's what I struggle with. Obviously, this bit's been really cut up. You don't need to see so many of the tears. This is the first time I'm talking about it to anybody but my partner. The staff at the hospitals were incredible. The professionalism that they showed. Again, I don't know where to begin. Just the way they spoke to me as a patient, the way that they treated me. There was the odd member of staff that was a bit lackadaisical, but you get that in any workplace. I mean, there was one point where I had 2 bottles of pee because I was stuck in bed. I had 2 bottles of pee on my table, and then somebody put my lunch next to them. That was a bit gross. There's no need for that. Like, you can easily move those and then put my food down. Maybe give the table a quick wipe. There's enough time for that. But in terms of the actual medical stuff, the emergency stuff, the priority things, the things that are really important, man, we are so lucky with our NHS. You know, the amount of tax that we pay into it is so cheap. And the fact that, could you imagine my hospital bill? You know, even if I'd been on private insurance. So anyway, that's enough from me. I've got his t-shirt. I exist out of spite from Mandatory Fun Day. His videos got me through the tough time too. There's all those other things that I can talk about another time. But I think for now, that's all you need. I'll be back to recording soon, and I'm sorry I've been away.